as I stated before too, having extra coverage across the front of the body is always ideal. No, feet up, knees up, feet flat. You don't want the sheets taut across the front of the body. Always be more revealing and less comfortable. So confirm where their arms are. So like I needed to confirm where she was at before I started like getting closer to the sides of the table. So there are her elbows and stuff in there. Oh, okay. Go ahead and put your hands over on your chest. Good. Now I'm going to show the shortcut version of this that I've used for forever, which is I just create a little U shape here, and then I'm gonna rotate your knees toward me. We're doing one more thing for your low back. I can go like this and go, okay, go on, turn your knees the other way. And that's how I can work. It ends up getting, more on the low back structures and come back towards me. But once we start tracking more laterally and across over to the front, more anterior, we are getting the obliques because the three main abdominal muscles go all the way to your low back. Good, back, just a neutral. And here too, just in being thorough, thinking about more of the abdominal muscles. If I can find the line of the ribs, not right in the middle, just lateral to it. So looking at your chart, where that six-pack muscle is, it's called rectus abdominis, where it lays over the external oblique, there does tend to be stuff that gets entrapped and kind of adhered there, especially up at the ribs. So more abdominal work if I were trying to do more stuff either for breathing, or there was some core stuff. Sometimes tension on these muscles can cause issues down into the pubis and stuff like that, but rather than going all the way down there, I work on the aspect of the muscle higher up and decrease some slack. So with the athletes, it'd be like groin stuff. Okay, good. And all of that will have more of a sense of like an actual like muscle sensation than just doing like generic knees over a belly button. Okay, knees over toward me. All the way as far close to the spine as I can get. And then go ahead and rotate back. I feel like there's a little more on that side. Yeah. So that felt a little bit harder to her. The tone of the muscles seemed a bit more to me. So I'm going to really apply more force, nice and easy. Okay, one more. So just one extra for this side to try to create some symmetry. Good. Come back. And the line of the ribs. See how that compares. So associated with kinetic chain related principles, this side of rectus abdominis and the obliques does not feel as toned versus the low back stuff was. So sometimes that ping pong pattern, the picture I have over there is saying kinetic chain, that can also run anterior to posterior, medial to lateral, as well as kind of this classic rendition of like which joint structures does it tend to ping pong back and forth to. So I would notate that in my charting and be sure to refine the future treatment plan for a said client, identifying, okay, there's something up with the left lumbar, and there's an aspect of that that also is involving the right abdominal muscles. Okay, now all we have left is a bit of the anterior thigh, upper leg. We don't have to do anything here. We've done everything we possibly can for the lower leg. So here, mobilize the skin. This is why you see me not always pay attention to that top leg in side lying, because I can get to that stuff really good here in this position. So moving forward with demos, it'll start changing to not just our set baseline routine, but showing you some adaptations that either I just personally make or Sarah personally makes, and or it'll be like setting up for if a person could only lay in certain positions. Okay, here we go. On an angle, not going just up towards the head. Angle, watching the toes. I'm rotating the hip internally. That is focusing more of our applications on the lateral side of the leg. So then I rotate, and I'm holding it with this hand, with my left hand, doing the same set of applications, but now the toes are pointed right at the ceiling, so the hip is in neutral position, but now I am on the medial structures. There's rectus femoris. So two rectus muscles, one for the abdomen, your six-pack muscle, one for your femur, both on the anterior side of the body. And if I just rotate the leg externally just a little bit so the toes are pointing away from the midline. Now I have to be careful, just because I'll be going a little bit downhill, that I don't have too much lotion and I slip. But this is where I can get the medial quads, some parts of sartorius, but also the rest of the adductors. Okay, I reset the leg, get the sheet reoriented, then this is where I can get the hip flexors. If I need to, I just rhythmically massage on the lateral side of the leg and work my way up, and with my forearm I'm feeling for either the greater trochanter or the anterior superior iliac spine, which is that front part of the iliac crest. If you look on the charts, you'll see that right there at that weird little hook at the edge of the iliac crest on the anterior side of the pelvis, a bunch of muscles attach just below it. By saying a bunch, there's two. But they're important. One, the longest muscle in the human body, sartorius. Okay. Down. Rolling that hip internally. One glide, two, and three. Point the toes to the ceiling, neutral. One, two, three. Externally rotate. One, two, and three. Reset, redrape, rhythmically work. Most people need more internal hip rotation. It is the key hip action we tend to lose as time and gravity and immobility takes charge. The more we can kind of constantly nudge and reinforce that for a person, the better. And I find those hip flexors. Same thing, that's where I can challenge the hip into internal rotation, external rotation. If I found something more specific, is where I could just tell a person, all right, Phil, I'm rotating your leg this way and that way. I'm going to have you do that now. So rotate your leg to the inside as far as is comfortable. Okay, good, relax, and rotate the other way as far as is comfortable. And switch, other way. Good, and switch, other way. And then that would be muscle energy technique. Contract, relax, antagonist, contract. If we're coupling it with inhibitory pressure, you push on a thing, you have a person shorten it, and then lengthen it. That's the gist. Okay. Here, a good starting application for the chest is soft fist, kind of the rhythmic, and kind of like cat paws. All I need to identify and confirm are the clavicles. So if you look on your chart, you got to just, I'm using my fingers, the back of my fingers, to just feel for those clavicles. Then I know where my knuckles go, I'm going to be in safe territory because I'm going to move down and away inferior to them. So if I just slowly work my way closer and closer to the sternum. Now rather than trying to just do both at the same time like this, like CPR, I'm going to stand a little bit to one side and focus more on one. It just lines my wrist up better. So I'm lining my knuckles and fingers up with that clavicle and just pushing everything away from the sternum and away from the clavicle. Now once I work my way out to the edge, and you'll feel it, you'll feel where the ball and socket joint, the glenohumeral joint starts. Now I'm more lateral, now I'm more medial with this one so that I can restart, and now I'm going to do the left side. Now through that, I've already identified exactly where the glenohumeral joint starts. I can just pin that with my fingers, find a wrist, rotate out. I do not need a lot of skin contact. Like I can literally just create a little roll with the sheet, kind of bump that with my forearm, make contact with the skin of the upper pecs, the pectoralis major, and then I'm in position to just, and this ends up being the most efficient one. There's other ways to work here, but to be able to use a forearm and to not have your face and head directly over top of their head. If I needed to stretch more, so there's these little rotations going in internal rotation, external rotation. If I wanted to create even more of a stretch, let the elbow go down into extension, grab just above the elbow, and then further external rotation of the shoulder. That way you just don't hit yourself in the face. And good. And we're staying right here. I just transitioned to using this palm right there for the biceps as a perfect example of doing what is a torsion force on the tissue, but it's not technically a need because I'm not using both hands. I'm just pushing with my right palm, but then I'm twisting in their entire body, bones and all, underneath. So this is actually a much more effective way to introduce that force, even though we wouldn't be able to technically call it a need. Okay? Then forearms, arm everything up. Okay, bit of lotion. Start right by the elbow. In this case, I end up using my right palm because I can, with the arm being able to be just at the edge of the table, it's the one time when you can just, everything tends to line up much more efficiently. Not like this is wrong, but I end up getting twisted if I use my other arm. So pull everything down towards the wrist. You really can assume everything that I said about like starting up near the elbow and approximating things towards the wrist, as well as really slow, deep, thorough kneads on these forearms, especially the proximal half, the half of the forearm closest to the elbow, is one of your best tactics for any elbow-related issue as well as wrist-related issue. Fingers included with that. And here's where I get more precise on the individual metacarpals, but then I go into those finger squeezes. And done. Reset. Come around. Now I just have to find that glenohumeral joint and find a hand. There we go. People always get twisted. Don't be overly delicate about it. You know, just get them unstuck. Okay. So notice this is where my hand can always be making contact. I can feel ball and socket joints. I want to be really more on the chest than anything else. This is one case where you really are going to be doing more of a side bend. So usually the biomechanics of that will be okay. You want to limit that tendency. You want to really keep your forces more aimed up with your nose, your chest, your belly button. But for this specific area, it just works too good to not do. Now, if it was more of a relaxation session, for the chest, I may just do those soft fist cat paw actions. It's a little bit more rhythmic, a bit more relaxing than this like compression plus stretch. Here you'll be able to see a bit more precisely what I mean. You just find pretty much where the elbow is. You can see the line. That's where you want to plant that palm. And in prone position, it's a similar position where I was putting my forearm. And just slowly glide toward the wrist. You'd be very surprised. So if somebody comes in with anything here, you're going to find something for sure in this area. And better to work on the big muscles and see if cleaning up the mess there helps, rather than getting down into like the tendinous, ligament, intrinsic tiny muscles. That's where you can have to be a lot more careful and really know what you're doing. Okay. I have a particular routine. I think Sarah does a little bit different than I do, but pinky thumb, ring index, middle thumb. Thumb and big toe, in terms of how they're numbered, are always 1, and then index is 2, and the pinkies are 5. Okay. Tuck back in, and then we're here. And then I have just a small nuance of how I tend to wrap things up, but head up. We've already done most of the head work and stuff, so all I really tend to end things with, if there was more shoulder neck stuff, I could go into using soft fists for the upper traps. We could We could go underneath the neck and use these fingers to do some point work. Like that. But if I've been more thorough in side lying, this is way harder on my hands. So I tend not to do stuff like that. I tend to just do something real kind of generic, pretend I'm a rolly bed for a little bit. It's the one time where I kind of do something that isn't the most biomechanic friendly, but just soft this, get my hands set underneath the neck, and now I'm going to scoop, scoop, create like goalposts. Then I'm going to leverage my elbows and forearms against the table and lift the head up, and that'll create a mild traction. Tractions, you just never want their head to tip up while you pull, unless you really know what you're doing. So here, I scooped, create a goalpost, and I brace my arms against the table and just lift the head up. I'm going to focus this attention at the lower cervical area. And I go down. I'll reset real quick. I'm going to reset more mid-cervical. And lift. Take that all the way to the base of the skull. And here. And swoopy. Forehead squish. Put a surprised, happy look on their face. Everything towards, out and away, and towards the scalp, towards the hairline. Contact on the lateral sides of the arms, the shoulders, legs, and then rock and brush the demons away. Whoosh. And whoosh. Okay, we'll get the bolster out, and I'll meet you outside when you're ready. And done.